Hello everyone, let's practice some Endodontics MCQs. While I recite the questions, you get ready with your answer in your mind. Not true about Gates Glidden drills is sequence from 1 to 6 with tip diameter 0.5 to 1.5. That is correct. Can be used only in the straight portion of canal. That is also correct. They have cutting tip. That is not correct. Cuts during withdrawal, that is correct. So, not true about Gates Glidden drills is they don't have a cutting tip. And they're numbered between 0.5 to 1.5 mm, 1 to 6. Each successive instrument shows an increase of 0.2 mm in tip diameter. That's the thing to be remembered. And there's quite a long explanation. Let's skip that. The most common error seen during excess cavity preparation of maxillary and mandibular incisors is perforation of the lingual or labial walls, gouging of pulpal contents, tooth fracture, all of the above. The most common error seen is perforation of the lingual or labial walls. This is the correct answer. Pulpal inflammation, it is marked by peripheral vasoconstriction, strangulation of pulp, increased vascular permeability, and decreased capillary pressure. Pulpal inflammation is marked by increased vascular permeability. Glass ionomer cement is used as a barrier over gutta-percha filling before bleaching an endodontically treated discolored tooth. Why is it done so? To prevent bleaching agent from dissolving the gutta-percha, to prevent percolation of the bleaching agent into the apical area, to prevent contamination of bleaching agent, to prevent discoloration of tooth from obturating material. The correct answer is to prevent percolation of the bleaching agent into the apical area. Bifurcations and trifurcations are most commonly observed in maxillary first premolar, maxillary second premolar. The correct answer is mandibular first premolar. Bifurcations and trifurcations. That's why it is also called enigma of the endodontist. In 2 years after RCT, a patient complains of pain over the gum of that tooth and the tooth is tender to percussion. Then the treatment of choice is extraction, retreatment of the root canal, epicoectomy and retrofill, an antibiotic course and re-evaluation at next visit. The correct answer is retreatment of the root canal. Patient having tooth fracture without involving pulp having sensitivity is due to fluid flow in dentinal tubules, stimulation of knob ending due to extensive pressure created by occlusal contacts, due to change in intrapulpal pressure, and having sensitivity is due to fluid flow in dentinal tubules. In F2 protaper, rotation is done 144 degree clockwise rotation, 72 degree anti-clockwise rotation. Yes, this is the correct answer. You can pause if you would like to have this explanation. Branching of pulpal canals is least likely seen in maxillary central incisor, upper first premolar, mandibular central incisor, mandibular lateral incisor. Branching is least likely seen in maxillary central incisor. Yes. To whom does the specialist have the primary responsibility? The specialists have the primary responsibility to no one or the patient only. Patient and the referring dentist. Errors that can lead to persistent microbial presence and endodontic failure include all of the following except one. Mark this exception. Inaccurate diagnosis, yes. Presence of tertiary dentin, missed canals, inadequate debridement, inadequate temporary or permanent restorations. Presence of tertiary dentin cannot lead to persistent microbial presence. Which of the following criteria will not be considered part of a truly successful outcome at a 1-year follow-up? No clinical signs of swelling, infection or inflammation, disappearance of a sinus tract, decrease of a radiolucency in size, no soft tissue defects or pathologic probing depths, no clinical symptoms experienced by the patient. And out of these, decrease of radiolucency in size may not be considered because all of this should be seen. No clinical signs of swelling, disappearance of sinus tract, radiolucency may or may not decrease in size in just a 1-year follow. Deeper invasion of root dentin by resolving tissues that extend into the coronal third of the root comes under which class of Heather-Say's classification? Extend into the coronal third of root, that comes into class 3. Deeper invasion of root dentin by resolving tissues that extend into the coronal third of the root. In cross section, root canal shapes are classified as oval, round, long oval, flattened, irregular. All of these shapes can be, but there cannot be regular one. Identify the equipment present in the collar plate. These are paper points. The imaging procedure of choice for most endodontic evaluations is periapical intraoral imaging. Because CBCT, it is costly and not readily available also. Most important factor in rapid progression of bacteria resulting in pulpal necrosis is host resistance, virulence of bacteria, dentinal fluid flow, and pulp vitality. The correct answer is dentinal fluid flow. Most of the bacteria in the carious process are non-motile. They invade dentin by repeated cell division, which pushes cells into the tubules. If the pulp is vital, it can protect itself against bacterial invasion and colonization. If the pulp becomes necrotic due to caries, trauma, operative procedures, or periodontal diseases, it can be very easily infected. This is because the host defenses do not function in the necrotic pulp tissue, and those in the periradicular tissues do not reach deep into the root canal space. Which irrigating solution has tissue dissolving properties? EDTA, sodium hypochlorite, saline, or citric acid? The correct answer is sodium hypochlorite. It dissolves the tissues. The organic tissue dissolution properties of irrigating solutions are most important for the success of endodontic treatment. Sodium hypochlorite has excellent antimicrobial and tissue dissolving properties. The tissue dissolving ability of sodium hypochlorite helps in cleaning the inaccessible sites such as isthmus, C-shaped canal system, webs, and fins. 4 canals are most commonly seen in upper first molar, lower first molar, upper second molar, lower second molar. The correct answer is upper first molar. 4th canal is common in mesiobaccal root and it is usually located palatal to main canal. Two separate mesiobaccal canals occur in 84% of teeth in which 2 separate canal orifices are traced. Although
The mandibular first molar has two roots, three canals are usually present. That's all for the today's practice session. In next video we shall again meet. Thanks for watching.